The type of conditions that we see that receive robotic-assisted surgery at Shawnee Mission Medical Center today tend to be mostly gynecological and urological. The urological patients often present with difficulty urinating, bleeding, things like that. Gynecological patients, often they will present with bleeding and endometriosis, long-term fibroids, oftentimes difficulty getting pregnant, and we see a lot of cancer patients here. We have one very exciting story about the fibroids. Dr. Lynch did a myomectomy on a patient who had uterine fibroids, and she later came back and gave birth to twins, and then later came back and gave birth in our hospital to another little child. So that's a good story. Robotic surgery differs from open surgery in that open surgery we have at least a 6-inch incision, and it's a deep incision. So there are there's a lot of disruption to the body. In robotic surgery, we don't have that disruption. The arms of the robot are very small, but they have a 560-degree articulation, and the robot provides a 10 times magnification for the surgery. Patients benefit from robotic surgery as opposed to the traditional open approach because they have so much less disruption to their body, and they have less bleeding because less area was disrupted. They have less infections. They stay in the hospital less time. They just generally get better more quickly. The robotic-assisted surgery recovery time is vastly different than the open surgery recovery time. In the robotic-assisted surgery, the patients go back to the doctor's office, depending upon the surgery, but particularly in the gynecological cases, they go back to the doctor's office within 2 weeks to be evaluated to see if they can start taking care of their families in terms of driving them to baseball games, attending their events, even going back to work. In the open surgeries, the normal expected time for those activities is 6 weeks. There are huge misconceptions about the differences in robotic surgery. The biggest misconception is the patients think that the robot does the surgery, it's programmed, and it does the surgery independently, kind of in an R2-D2 fashion, and that couldn't be further from the truth. The robot arms lay completely still unless the surgeon is guiding them. I think that the thing that differentiates Shawnee Mission Medical Center from other hospitals in the area is we have the longest running robotic program in the city. The first robotic surgery in the country was done in 2000. The Shull family brought this technology to Kansas City at Shawnee Mission Medical Center in 2002. That was a general surgery that was done. Then in 2003, Dr. Emmett and Dr. Montgomery did the first urological surgery, and in 2007, Dr. Lynch did the first gynecological surgery here. So we feel that we can offer all of that experience to our patients. I'm Penny Bedell, an RN. I'm the robotics coordinator in the operating room at Shawnee Mission Medical Center.